Welcome to the Heart of Healthcare podcast. I'm Hallie Tecco.
And I'm Steve Krause. And every Monday, we bring you the latest in healthcare innovation as we sit down with entrepreneurs and industry experts.
So buckle up and join us as we figure out how to improve healthcare for all. Hello, listeners, and welcome back to the Heart of Healthcare podcast. It is July, and we are celebrating 3 years of the show. To celebrate with us, we'd love if you left us a quick review on Apple Podcast. Thank you so much for being a listener. All right, today I'm speaking with Emily Oster. Emily is a professor of economics at Brown University, where she is a health economist. She has written several best-selling books on pregnancy and parenting. Her first book, Expecting Better, came out in 2013 and has sold millions of copies. And her fourth and latest book, The Unexpected, just came out and is already on all sorts of bestseller lists. Emily, welcome to the show.
Thank you so much for having me.
Tell me the story about how you went from academia, teaching, research, to being a health communicator.
So I got pregnant is the short answer. So I was a professor at the University of Chicago, and my work is about data and health. And I got pregnant, and I found myself quite frustrated with the healthcare system, with the general advice that people were giving me during pregnancy, with the lack of explanation more than anything else. And Expecting Better is the book that came out of that frustration. I started doing a lot of research using my academic skills, using the stuff that I was an expert in to try to understand what was the data behind a lot of the things I was being told to do or told not to do. And Expecting Better is the fruit of that labor. And then the rest of the books came from there.
Did someone say, you need to put this into a book? Or did you just say, I wish
kept
this
saying
was?
It. Yeah, I think I kept being like, there should be a book, you know? Yeah. And then I think a lot of people say, I should write a book about that. But then I did it. So that was.
The healthcare system has traditionally been very paternalistic, especially when it comes to women's bodies.
That is true.
As a health economist, you've taken a non-didactic approach and you kind of treat your audience as capable adults who can make smart decisions.
Yeah, I think the core pitch of everything that I write is like, here is the information for you to make your own best decisions. And so very much not like do this or don't do this. There are occasional moments of that, but for the most part, there are many good choices, and you need to take these data, understand them like an adult, and then make your own choices based on that.
Yeah, which feels very different because it's usually, we're not going to tell you why, just like don't drink alcohol at all during pregnancy. We're not going to tell you why. We're just going to say, don't do it.
I think it feels different from a lot of the way we're given advice during pregnancy. It doesn't feel different from a lot of the way we interact with the rest of the world, which I think is where my frustration initially came from, that I was used to being treated like an adult. You know, I had a job. I went to like every other interaction with even people in authority up to that point kind of respected my autonomy. And then there was this moment of like, somehow you're not an adult anymore. You're a baby vessel, and we don't need to explain to you because your brain has gone the way of the baby somehow.
A lot of what you do is translate the research. And research, for a lot of reasons, isn't really accessible to the average person. You know, what in one way, because it's very expensive to get access to journals. Mm-hmm. I'm curious if you have thoughts on the open access movement.
So open access has been great in a lot of ways because I think you're right. I would like people to have access to be able to read the studies that are behind whatever is the panic headline or the questions that they have. And I actually think more people are capable of reading those studies than one might have thought. So the idea that somehow this shouldn't be something people are able to access because they couldn't possibly understand it is an overstatement. Open access has also generated a lot of predatory journal behaviors and a lot of incentives for journals to have people pay them to publish papers that are not very good. And so I think there's a real tension there, which is like, when you read something that's in the New England Journal of Medicine, it might cost money to get it, but most of the time, it's a pretty reputable experience. And that's not going to be true of every study you find on the internet.
So how do we solve for this? Because it feels like maybe the pendulum swung too far in the other direction, and there are too many low quality studies now that it's like another problem. It's like you can access them, but they're maybe less reliable. They're not peer reviewed. I've heard that they're like, people will find like AI snippets in the articles that people like forgot to take out.
Yeah. I mean, I think this is really hard. And what I would say is I think it becomes a bigger problem when those studies are put out in the world. So if the answer is a bunch of people are putting papers in open access journals and each other are reading them and no one's making decisions on them, I'm not sure we have much of a problem beyond that group. I think it's when, BuzzFeed or the New York Times starts talking about things that come out of not reputable outlets, or even reputable outlets where the quality of the papers are not very good, which also happens. I think that's where there needs to be almost more sorting on the media side, actually, because that is where we're getting people then, reading a lot of misinformation.
Yeah. Yeah. It does seem like you'll see headlines. It'll be like, popcorn causes cancer.
Yeah.
Versus
Totally.
like in a small study of 3 different popcorn brands, we found, XYZ. It feels
or,
like.
The 2 categories of panic headlines that are my least favorite are the kind of correlation versus causation stuff where it's, pick your poison, Doritos, popcorn, whatever causes cancer. And then it's like, okay, people who eat a lot of Doritos have more cancer than people who don't. Well, how do you know it's the Doritos? Like everything else is different about these groups. And then there's the mice studies where it's like we fed mice exclusively Dorito dust. Yeah. And after their entire lives, they weren't doing great. No kidding. That doesn't sound good.
They don't thrive. They're not thriving on Dorito
They don't thrive.
dust. Yeah. Have you done anything around just helping people, like a blog post that's like, here's walking through a journal article and how to decipher it, the things to look out for?
Yeah, sometimes. And so I think that's hard because there are some pieces which are pretty obvious, which I talk about a lot. And I've talked about sort of formally and then in individual examples, like, looking at the 2 group, it's not randomized. Look at the 2 groups and think about, are they different in other ways? Try to think about, does it seem likely that this treatment is random or that this behavior is random? Because if you're trying to get a causal estimate, you need some sense of randomness. But I think what's hard about this is sometimes the reason that I can sort of see that something must not be right is just that this is my job. Right. And sort of explaining like, well, I went to school for like a billion years for this. And then I was a professor of it. I teach it, like I know when I look at, so like there was a study about fluoride and like IQ. And people said, and there were these panic headlines, fluoride during pregnancy lowers IQ. And like, I've read a lot of literature on this. I know that at the levels they're talking about, we don't see these correlations. And so then I'm going in that paper being like, I kind of know there must be something funny here. And then the question is, how would you know where to look for that? And the answer to that is just experience. Like read until you get to the thing where they're like, we excluded the 6 people who smoked. And you're like, why would you do that? And then it's like, check out appendix table E13 where we've re-included them. It's like, oh, all your results go away when you put in those 6 people. Like, I see. But how do you explain to somebody, like, you got to know when you're looking for table E13?
Yeah.
That's hard.
Yeah. It's like you're a detective. You're a health data detective.
Like it's a weird detective skill.
Yeah. One of the benefits of open access is to reduce, in theory, publication bias. If we are only incentivizing researchers to publish results that have statistically significant, meaningful, like New York Times headline results, then is it really an accurate portrayal of the truth? Curious kind of your thoughts on this and how much of a problem publication bias really is.
Publication bias is a pretty significant problem. And you can see that in a lot of different ways. I mean, the simplest is just like people like significant results. And so there's a lot of p-hacking and, social psychology has had a kind of tremendous replication crisis of late where many of the results in that field are not replicable. I think that there are pieces of this throughout the kind of health research where basically people are just only publishing the studies that seem significant. Yeah. I'm not sure how much that gets fixed actually by having more outlets, because the reason that this is happening is that is the incentive of the researcher, partly because they want to be published, but partly because they want attention. Because some of what matters is whether your paper gets cited and whether people talk about it. And the incentive for publishing negative results is always going to be more limited. And there are places where like we can try to combat that more directly, like with pre-registration, right? So for randomized trials, like we always want people to pre-register them, and then we can have a sense of, what are the trials that are being run and which of them are they successful or not. But that's mostly going to be true for large randomized studies, not for just I ran some correlations and I reported the ones that were significant.
Yeah. Was it at HBS last year where the professors that studied honesty had been
just
with their data?
Yes, there's a lot of irony in that particular example.
Yeah. So going back to just people accessing information, I think most people are overwhelmed with information and really struggle to decipher between the truth and misinformation. And to make things worse, the pandemic completely eroded a lot of trust with the medical system. And so people are seeking information from people that have no credibility, but are saying the things that they want to hear. As an effective health communicator, what are your tips for listeners to help cut through the noise, build trust, and help patients just find accurate information and make wise choices?
So what I think is very hard about that question is once the patient is coming and asking for help to find good information, you've kind of already fixed the problem. Because I actually think, there are plenty of good outlets where people could get information. And even if they say, I don't trust the CDC, like those guys screwed me over in the pandemic and I don't want to hear from them. Actually, you have a question about your kid, you can send them parent data, send them to the AAP, send them to any number of quite reputable sites where they will get a reasonable answer to their question. I think the bigger problem with misinformation and with people's information overload in general is that so much of the information is being pushed on people rather than asked for. So, like, what's the problem on Instagram or TikTok? It's not that I went onto TikTok and I was like, is birth control dangerous? And like TikTok delivered me the answer where you could be like, hey, a good source for that information is not TikTok. It's one of these other websites. It's like I was surfing TikTok looking for dance videos of people like clogging to like Beyonce's new song. And what I got was like birth control kills you. And so that's the piece of information, I think, misinformation that's really hard to combat is when people aren't looking and then it's right there for them. And then you start to worry about it. And I see this in parenting too. So people's panic headlines come to me. They come to me not because people said, I went and looked for this. They're like, this thing showed up in my feed and like, did I ruin my child by giving them puffs?
This morning, I saw a video of a woman with a newborn, and she said, I saved $18,000 by having this child in my bus versus at a hospital. And really, really encouraging the home birth movement. Okay. Yeah, you're exactly right. It's in your face everywhere and could influence choices.
Like, that's such a great example because, like, the question of, like, am I a good candidate for a home birth? Like, some people are a good candidate for a home birth, and that's a question you could ask, and you could get like reliable, evidence-based answers to the question of what kind of attendant would you want? Would you want to be in a bus? What would be some good places to have your home birth experience? But if the way you're getting the information is like buses are great places for having a baby, like that's actually not. Yeah, that's not good.
Yeah. Do you think that the social media platforms should play a role here?
I don't. I think it's very difficult to write. Very difficult to write rules for social media platforms that would result in better outcomes. I mean, this is actually a topic my husband works on. He's also an economist. And,
this is what you talked about at dinner last night.
And he has a paper which is basically about the sort of the idea that it's there are some things that you might want social media platforms to regulate, like saying this person lives at this address, doxing somebody, things where the information itself kind of could be weaponized immediately. But when you're starting to talk about regulating speech or regulating kind of what type of information is coming out, it's actually much harder to use that to effectively change people's minds.
We'll be right back after the break.
This season, Instacart has your back to school. As in, they've got your back to school lunch favorites, like snack packs and fresh fruit. And they've got your back to school supplies, like backpacks, binders, and pencils. And they've got your back when your kid casually tells you they have a huge school project due tomorrow. Let's face it, we were all that kid. So first call your parents to say I'm sorry, and then download the Instacart app to get delivery in as fast as 30 minutes all school year long. Get a $0 delivery fee for your first 3 orders while supplies last. Minimum $10 per order. Additional terms apply.
We had Frances Haugen on the show. So she
Yeah,
was like the Facebook whistleblower who kind of knew what was happening to the mental health of young people and spoke out about it, which was a really cool episode.
Yeah, and I think that's the sort of the young people piece I would put quite separate from the question of like, should you regulate information? I think is more of a question, should you regulate access, where I would be a fan of having fewer teenage girls on social media.
Did you see the Surgeon General's suggestion? Yeah, so he's...
I think, his suggestion is that we not allow, that we have a warning, right? Like we do on cigarettes.
Cigarettes.
I think that's a good idea. I actually think there's lower hanging fruit, to be honest, which is like, we shouldn't have phones at school. So why do you, in some sense, these things are all a little bit related, but part of the problem here is a coordination one. And I think maybe the role of policy is to try to help people coordinate, because, when I talk to people, my sense is that actually if no other kids had Instagram or Snapchat or whatever, you also wouldn't want it. And so the problem is that everyone else has it.
Well, correct me if I'm wrong, though, warnings on cigarettes actually didn't change behavior. It was the taxing of cigarettes that changed behavior.
Yes, it's very difficult to get people to change their behavior by telling them things. And we see this in diet, right? Also, like we spend an awful lot of time telling people the vegetables are good. Like people know vegetables are good. That's not the problem. That's not it.
Yeah, exactly. Okay, well, I want to talk about some of the work that you did during the pandemic, because it was a difficult time for everyone, but you took on another job on top of teaching, on top of writing, on top of parenting your own children, which was really taking a stance and becoming a leader of the movement to reopen schools. And you dug into the data yourself, jumped directly into what became, unfortunately, a political controversy. Tell us about kind of that experience and how that shaped your work and your own mental health, because it was a shit show.
It was a shit show. I mean, I wish that I could say that any of that was very deliberate. The pandemic started, my kids were home like everyone else's kids. And, when the school year ended, it was very clear to me from looking at my kids, from looking at the world, that like this hadn't been a great experience. And I am very excited about data. It's my love language. And I tend to think that if only we had data, we would be able to make good choices. That's kind of like the tenet of my whole thing. And it was also becoming quite clear that we were not in a position to get the kind of data we needed to answer, like, how are we going to open schools safely? And so actually very early in this period, like before everyone was really talking about school reopening, I started collecting data about childcares and then about camps and sort of trying to triangulate, like, how could we learn about schools, and ultimately ended up like leading this effort to collect data about schools and COVID in schools. And it then became very clear, at least to me, as of like September or October of 2020, that like schools were not a risk environment or not a significant risk environment. And then I started talking a lot about how we should reopen them. And that was a very different experience than what I had done professionally before, because, I'm not an advocate, right? Like I sort of spend a lot of time in my books being like, here's what the data says, here's kind of how you can understand this study. But that's quite different than being like, look, you need to open your schools. Like, this is not good. And, going out and saying like, we need in, the Atlantic, like we need to open schools. And then a lot of people were pretty mad.
But the CDC agreed with you.
But then later I was right. Yes. I mean, I think but like fundamentally I was not wrong.
Yeah.
The data, the data we had at the time was very compelling. I think putting together all of the pieces of evidence people should have known in the fall of 2020. And ultimately, many, 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 many months later, other people agreed. And now I think when people talk about this and they look back and they say that was a huge mistake. And I think it was a huge mistake.
Yeah. How did you handle that though? Because you're obviously very unemotional about the way you deliver the information. And then all of a sudden you were part of what was political, what was dramatic, what was a lot of underlying just anxiety about the pandemic that came out against various leaders in the space. And I'm just curious
One of the more frustrating pieces of pushback was the people who would say, this person's just advocating for open schools because she hates her own kids and she doesn't want them. She doesn't want them in the house. And the thing I wanted to say to those people is I do want my kids to be in school. But the thing is that I am a very, very fortunate person with a lot of resources. So my kids went to school September 3rd, 2020, and they would have done that whether I advocated for this or not, because they go to a private school, because we have a lot of resources. The problem here is not the children of professors. The problem is that there are a lot of poor kids, a lot of Black and brown kids in this country who are at home. Their parents aren't there because they're essential workers. They are supervising their younger siblings and they aren't on Zoom and they aren't learning anything. And those are the kids that you are failing. And I think that was the piece that made me both get up to do it again and also frustrated. I know sometimes I say it I have a very thin skin, but also a very short memory. And so when I would write things and then people would yell at me, I would feel terrible, but only briefly. And then a week later, I'd be like, that wasn't
You go
so
on
bad.
a run
Yeah.
and then you're like, okay.
Yeah, exactly. I'd go on a run. I mean, the worst, actually, interestingly, at the very end of the pandemic, after all the school stuff, I wrote something about forgiveness. I wrote something called about pandemic amnesty, which was we should try to move on. And it was it was interesting because I wrote it in response to what I saw as kind of a push from the left to almost relitigate the question of schools. And rather than get focused on fixing the problems, wanting to be we actually were right all along. And I sort of felt like that debate was pretty frustrating. So I was trying to get people to just kind of move forward, but it ended up people were not ready to forgive. And that was really that. I go to death threats. We got a lot of, there was a lot of bad stuff. But then later I was just that wasn't so bad. My husband was somebody flew an airplane with your name on it. And I was oh yeah.
Oh gosh.
So he doesn't have a short memory, but I do.
Oh my gosh. So what has been kind of the highlights of the impact that it did have on keeping these kids from school? So both the young kids at the time, and then I'm also curious about a stage that my niece was in, which it was the end of her high school. So she didn't get to do homecoming and graduation. And it was the beginning of college and she didn't get to go to college that first semester. So kind of two different groups that I think were really impacted.
Yeah. So I think we know much more about the first group, in part because that's the easiest thing for us to measure is test scores. And so we know that, kids lost a lot of time. The first tests that we saw after the pandemic were much worse than before. And of course, that was much more true in places that had less in-person schooling. And those results, those test results have kind of only slowly clawed their way
Have they
back.
caught up? Or
no, not everywhere.
They're catching up?
Catching up. In English, they test in English and math. And in math, they're kind of crawling back in most places. And in English, in some places, they're basically back. And in some places, they're not at all back. It's been a little bit, the patterns there are kind of interesting. I'm not sure we totally understand them. But for little kids, I think there's that piece. For bigger kids, for the older, the kids in your niece's age group, I think it is going to be a while before we understand the impacts there. I mean, there are some you'll be able to point to college going, which is likely to be lower because kids left school. They didn't enroll in community college. We know that like community college enrollment rates went down in that cohort. So there'll be some things there. But this piece of like sort of missing out on what you might view as an incredibly important part of almost like growing up, I think we can see a little as faculty members. There's definitely a sort of group that was a little, seemed like missed some things, but I'm not sure. I think it'll take a while before we see what really happens there.
Yeah. So you started this company called Parent Data, which is a data-driven guide through kind of parenting, pregnancy, the whole gamut. Tell us about your company as a life as a founder.
It's exciting. So I started this really as a newsletter during the pandemic, and it's become an online platform where we serve content in a variety of ways about pregnancy and parenting, and really aim to be a place that people go instead of late night panic Googling, is the way I would put it. So this is the place where you should go when you have a question, when you want to seek out good information about pregnancy and parenting that's data-based, that's evidence-based. And a lot of the writing is me, but some of the writing is others. We have an amazing person writing on late reproductive phase, perimenopause, menopause, and from whom I have learned a tremendous amount about my own personal health experience.
Yeah.
And so that's the platform. And it has been extremely interesting to learn about running a company. It is a new and exciting challenge that mostly I like.
Yeah. So, I mean, it sounds like it's geared towards women, families, kind of along their lifespan. What are some kind of key issues or questions that you're most excited to explore going forward?
Yeah. So we right now, I think our coverage, sort of content coverage, is very strong in pregnancy, very strong in sort of young kids, and we have a growing content space in this kind of late reproductive menopause phase. I think we're looking to expand throughout the life cycle of women's health and kids' health. So into fertility, into sort of parenting older kids. You know this, but like women make 80% of the healthcare decisions in their houses, and they don't have the information that they need. And I want this to be the information that they need.
Yeah, I love that. I actually, it was funny. I just saw this morning a pitch deck from a company that is helping people understand their health insurance eligibility. But the team was 9 people and all men. And I just wrote back and I said, I can't even like meet with you guys. Women make
no manners.
It's like women make 80% of the healthcare decisions. They're the ones who are picking the health insurance. They're the ones that are making the appointments. To not have women represented on your team of 9 people, it was just crazy.
Yes.
So your new book just came out. Congratulations.
Thank you.
Talking about something that is not as universal, luckily, but more common than we even know, which is kind of pregnancy complications. And one of the things that you said in there really resonated with me, which is, you said the discussions I had with my doctor on this and other topics were challenging because I didn't have enough information to even ask the right questions to begin with. And that was like such a, when you go in and you're like, I'm ready to take notes, but you're not even able to guide the conversation because you don't know what you don't know.
Yeah. And I think in our medical conversations, we have often so little time. But I often say, if you and your doctor were having like a long dinner, it would be fine. You could bring up, I'm kind of vaguely concerned about this. They could explain it to you. You could talk about it. But what you have is like 8 minutes. Yeah. And so you need to come into that 8 minutes with enough background, not to be the doctor. You're not the doctor. You're the patient, but with enough background to know what to ask and what are the important questions that are going to help you lead to a decision, right? Because you need to understand what happened to you. In the case of pregnancy complications, people often want to ask questions about, what could we do differently next time that might lead to a better outcome? Am I a good candidate for different kinds of treatments? And just having that scaffolding to have that conversation in a productive way that is fast, that turns out, I think, to be important in this space, but in other healthcare spaces too. I actually think this is not just about pregnancy complications. I'd like people to have this with their pediatrician also, that, to know this is what's going to happen at your well visit, and here are some common questions, and here are some questions, think about the questions you want to ask.
Yeah, at the end of the peds visit when they give you like that one pager.
Sure. I know about the one pager. Yeah.
You're like, actually, I want my own one pager before going into these
Exactly.
appointments. Yeah.
Totally. Yes, I always feel like I leave and then I'm like, I forgot to ask about the following neurosis that I'm having this week.
Yeah. Yeah, exactly. But I mean, with pregnancy complications though, too, there's an additional, and I think a lot of fertility, I would say, is another area where there's a level of emotion, a level of uncertainty that also kind of clouds your ability to effectively communicate in that moment with your physician or clinician.
Totally. And I think people are afraid, they're anxious. You almost don't want to ask the question because what could come back is not good news. And I think the provider is also not interested in giving people bad news. And so there's some value in, especially in these very hard conversations, having somebody else there with you. So you're not the only person hearing, because it's hard for us to hear things in the moment.
Which you weren't allowed to do
during COVID. Yeah. I mean, I remember early on when people were having baby, like there was like your partner can't come to the birth. That was like a brief period in New York.
Yeah. My sister gave birth alone with a mask on.
Totally insane.
Yeah. Yeah. So lastly, and this is a question I ask all of my guests, if you could wave a magic wand and fix anything about our healthcare system, what would it be?
More midwifery care in pregnancy. I think that some of the problems with not having enough time have to do with the structure of a system where most people are being treated by someone who is also a surgeon. And there is most of our peer countries have something closer to a midwifery model where low risk people get that care. And I think that would be really good on a bunch of dimensions.
I also love the centering pregnancy model.
Yes.
Yeah.
Yes, which I think has in some ways some of the same, I mean, they could both in some ways get to the same thing, which are just more time and more opportunities to get questions answered.
Yeah. Yeah. Love it. Well, Emily, thank you so much and congratulations again.
Thank you so much.
Thanks for listening to The Heart of Healthcare. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and review, and don't forget to subscribe. The Heart of Healthcare is produced by Hallie Tecco and Steve Krause. The show is engineered, edited, and mixed by Kyle Moore. Visit our website, heartofhealthcarepodcast.com, for show notes and episode details.